I am Kyle Celine Dorado, your first ever mutya ng Pilipinas, Pampanga, and at the same time, I'm also a news correspondent. My genetically deep-set eyes on the upper third of my face was treated, as well as the lower third of my face with Ulthera and the chin fillers. And now I'm coming back again to, for my middle third to be proportionate, because most of the times always almost in front of the camera. So I am coming back again to Dr. Contessa to get my nose fillers done, which I did last year. I've had my last scaffold nose, which is like a 5-minute surgical nose finish. And I'm very much excited. Stay tuned for more and watch the video till the end. Also, don't forget to subscribe, hit the like button and the notification bell so you guys would be updated.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome back Miss Casey.
Hi everyone, I'm back.
Yeah.
Thank you, Doc.
So, like a week ago, we did a treatment on Casey, the so-called Perfect V, as well as the Enchanting Eyes. So, how was it, Casey?
I've noticed, Doc, the instant effect, and at the same time, the downtime was like only hours.
Yeah.
And the healing process, not so much po, parang wala lang yung
Right.
day-to-day,
Exactly.
normal lang as per usual. And I'm very, very happy with the results because it's so instant, Doc. It's only been a week. And my face has gotten thinner.
Thinner and narrower, yeah. Because what our goal was to make the bigonial width narrower, okay? So this part here of Casey, there's a photo actually being shown to you right now that there's already this result of making it slimmer here, okay? So for a female face, we wanted it be contour or the inverted triangle. And then on the part of the chin, okay? So we did some filler injections there using our radius, and somehow I've seen the volume and I've seen the improvement of the shape of the chin, right? Because we wanted it to somehow contour it in like an inverted triangle. And then we did Ulthera shots too, right?
Yes po.
So actually this is just a 1 week, and we were explaining that Ulthera will still take effect in 12 weeks time. Plus also we did the Xeomin injection here, so we had like a week already. So actually we'll have another 1 week for it to still take effect. So you're still expecting improvements, okay? With the Enchanting Eye area, okay, we did also for the temple region radius injection there. So we noticed a volume correction of the temple area. So there's a lifting of the corner of the eye. Okay, actually instantly we've seen that. And then under eye injections also to improve that sunken under eye or hollow under eye. And well, I was checking on the forehead of Casey, because part of the Enchanting Eyes is also injection of our botulinum toxin to get rid of also those lines and wrinkles. And she's still young, very young, so you don't need it yet in this upper third of the face, okay? So we just did like the radius and the balance under the eye area and also some Ultera shots there. Okay, thank you so much for that.
Thank you.
Okay, so in this episode now, we're dealing with the mid-face section, the center of the face, okay? In the past, we've done already the non-surgical nose enhancement for cases. So we can do a booster of the nose enhancement, and then on the area, the subnasale to the upper lip, we're gonna improve the skin there as well as the filtral column. Okay, we'll be doing treatment there. And then on the upper lip, it's a concern of Casey. That's the right you mentioned to me. There's asymmetry of the upper lip region. So we'll be doing a correction of that for today. Okay, so we'll show the kind of treatment when CSA Medical Aesthetics return. We're back, so we're doing the center part of the face. We'll be working on the nose, the booster nose enhancement, and then also the below the nose area, the skin here, we'll be working on that, and we'll be doing a correction of the upper lip asymmetry, okay? So as with any other procedure, you have to do like a cleansing, and then after that, you may apply topical numbing cream, but for now, our anesthesia will be the so-called pain freeze. It's a spray, it's a coolant, and it gives an instant numbing effect, okay? So it's a topical anesthetic, and it's a cryogenic anesthesia, and it helps really relieve any discomfort while we do the procedure. Since we'll be working on the nose, so we can actually directly spray the nose part, okay, the skin part, and then after that, so there's a certain degree of cold sensation, right?
Yes.
Yeah. And then since my entry point will be this part, because I used to really do multiple injections of my lidocaine, just a little bit on the entry point here, okay, just to numb this puncture area. So I don't need to already puncture the entire nose bridge. And then we'll make a tiny entry point. So this is again a booster of our nose thread lift for Casey, just to enhance again our nose. And then we'll be gliding. Since this is already a repeat injection, okay, so just a glide. So this is now our second PDO nose thread. So she had already this procedure done in the past, so expected to have some tissue resistance inside. Since we are stimulating fiber formation, so it's normal to feel some of our inside tissues will be already like trying to inhibit the entry of this PDO thread. Okay, so we have placed like just 4 pieces of that, and I can already see an improvement. So we'll proceed to the tip region. So let's proceed to the nasal tip columella projection. So I'll make an entry point again for that one. So follow the center of the filtral column and then make your puncture point. And I'll be using PDO short thread for this part here. So we'll just be gliding into the intercrural space there. Pinch the columella as usual and expect some resistance. And it's just gliding in that space there, and we need one more with that one. And since this is just a repeat treatment or just a booster, so few threads will be fine. So we use 4 on the bridge and 2 on the nasal tip. Okay, just gliding, just feeling some resistance there. So this is not an easy technique, just to take note. You may see it in the video, seems like easy, but you require training for this. So we're done with the nose. We'll do the skin part at the subnasale or below the nose tip columella here. So we wanted to improve the length of this part also here, okay? So we have a procedure right now where we do like a thread insertion also in this skin part of the upper lip area, okay? Some will call it like a lip flip, okay? Or like upturning the upper lip area, like if there's inversion already, it's also a way of inverting the upper lip, especially for those with thin layer lips, or those with those inverted lips already because of the aging, okay, or some with like it's been there since birth, okay, so they still want to improve it in a non-surgical way. So what we can do with that is we have a treatment so-called the insertion of very short PDO threads, like for example a 10mm type of a thread. So this part here, I just noticed some, you know, in the past, right, Casey, we may have some like remnants from some accidents in the past. So actually this area here, like, it's not even like visible on cameras or on TVs, right? So, but like I as a skin doctor, I can see these marks here. I can still improve that. Actually, I want to inject also like a triamcinolone here, like a via meso injection here, just to somehow make it flatter or flat. Just a tiny injection there. So a little bit only. And then after that, we can inject already our PDO threads. Okay, there you go. So we'll be doing the skin below our nasal tip columella. So I have my pain freeze. I'll close the nostril. Okay, it's okay just to do that. Just a quick pinch, okay? Inhale. Okay, and then quick pinch and then spray. Yeah, just cold and then apply your OS. OS, quick, and then there you go. The pain freeze, actually, you have to wait for it to be white or to frost. And then it seems like it's dripping, but it's not. It's because it immediately evaporates as soon as like it reaches the skin layer, okay? So I have like a 10mm length of a PDO thread here. We can do like an insertion from this side here. So just a quick Casey, okay? This is just like a pinpoint insertions of those threads. And just a small one here. Okay, there you go, and pull out already. Then we'll do the other side. So again, this is a 10mm PDO thread to improve the skin in this area here. So actually, it's normal to feel the pricks here. It's a sensitive area. Okay, the last time we were doing procedure on Casey, those are tolerable. But whenever we do like this part of the face, alars to the upper lip, it's really the sensitive part. Okay, sorry for that, Casey. Okay, let's proceed to the upper lip improvement. I'll be using a Restylane case here. So the good thing with Restylane, it also has a lidocaine with it. So it's still gonna numb your upper lip area. And I can still spray my pain freeze, okay? So just this part here. Okay, I'll pinch again, okay? And then be prepared with a cold spray. Ayan. And then let's dab that. Okay. So I've noticed a while ago that the right side of the upper lip is kind of like downwards, okay? So what we want to do is to improve that. We'll volumize the right side, okay? Improve the length of this one here and the width of this one here. So this is a tiny needle here and just inserting into that lip line there, okay? And this part here, just a little bit, little and little, less is more. You don't need much. Actually, Casey has a good volume. It's just the lip definition that we need to improve. And then I'll be doing the so-called lollipop technique here to kind of like invert this part. Just minimal amount there. Minimal amount. And there you go. So expected to have some pinpoint bleed. You okay, Casey? So this part of our face is a bit sensitive. Sorry, Casey. You're okay. There you go. Now let's improve the philtral column. Okay, I noticed that there's no definition also of the philtrum. So the way to improve that is you have your needle here, direct it first into this upper border of the cupid bow here on the right side and just inject a minimal amount to balance it with the opposite side. And then follow also the line, the philtral column line there to create that right philtral column here. So ideally there should be The center should be sunken at this part here, but the borders are not delineated. Okay, just a bit of that. And let's also improve the so-called upper lip tubercle, this part here, center. And just pinching that, and we'll be applying a bit of our filler there. And this is what we call balancing of the upper lip asymmetry. So we have injected this part here, only the right side, just to balance with the left. So far so good, Casey?
Yeah po.
Okay, so we did like a center nose enhancement, upper lip skin here, improvement with some PDO threads, and the so-called balancing of the upper lip section. We'll show the result to Casey when CSA Medical Aesthetics returns. And we're back. We'll now give the mirror to Casey for her to see what had happened. Okay, there you go, Casey. Yeah. So the procedure basically was on the center part of the face, the nose, the skin above the upper lip and the upper lip region. So it's a correction of the upper lip asymmetry. Okay, initially we wanted to like do some minimal enhancement on the upper lip. It's a gradual process. Little by little, it's gonna still like balance. Okay, the filler was just inserted right now, and as time passes by, the filler will also like, you know, improve on its own because it's hydrophilic. It's still gonna further volumize. It's still gonna give that more contour. And actually, with these kinds of procedures, you can come back to us to still do like some touch-ups there. So I've noticed the nose region, the bridge and the tip, again, they were like enhanced. They kind of like increase in height again. So how was it, Casey?
You're right, Doc, about the it will still improve because I
Exactly.
have noticed that my under eye, when you have injected like the enchanting eyes,
Right.
after a week, I really noticed that it's still improving po, the look. And then my under eye bags, which
Yeah.
are genetically
Yeah.
nandyan na siya, parang nawala po talaga unti-unti,
Correct.
Doc.
Yeah. And considering we just did that under eye filler a week ago, right?
Yes po.
Yeah. So as a summary again, we did like a nose thread lifting, so bridge of the nose and then the thick columella there, and then the skin beneath the nose. So we inserted few of those very short PDO threads there, and on the upper lip we used Restylane Kiss to somehow enhance it, and we'll still give time for it to improve because we just injected it right now, and so far so good. Okay. Thank you so much.
Thank you so much
Yeah.
po for your magic hands, Doc.
Thank
you
you.
so much po.
Yeah, and well, this kind of procedure a while ago, because actually I was noticing Casey that she felt more of a discomfort on the skin above the upper lip. Well, I explained to her that there's really a sensitivity there, especially that part. So you feel the needles, right? Which is expected, but somehow it's tolerable, right?
Yes po.
It's kind of like tolerable also, and we've done just quick injections there. Okay, thank you, Casey. I just have another question for you. Like, how effective is this non-surgical procedures, especially for you?
Well, as for me, like what I've said in the past video, these non-surgical procedures are very, very much important for people who want to maintain their natural features, but you know, for enhancement, and at the same time, I think for me it's much safer po, Doc,
Yeah.
especially with my age. And of course, I'm entrusting my face with a trusted doctor, stellar Dr. Contessa. So I really thank you so much, Doc, for really having me here.
Especially for those who are very busy, they just want a procedure that is really quick, and at the same time, no much of a downtime, just a minimal downtime only, right? And still, other people are afraid of knife or cutting. Okay.
Like me, Doc.
Yeah, pareho tayo. I'm also afraid of the knife or the cutting. Okay, thank you so much, Casey. Now, if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Casey, if some of them are or may have some questions about what you have done, like or they wanna like follow you, do you have any like a social media
Yeah,
that they
please
can
do
follow?
follow me on Instagram at Celine Kyle D and on Facebook Kyle Celine Dorado Lohed. If you have any questions, don't
Yeah.
hesitate to DM me or PM about my experience here. So thank you so much. For
Some
that.
are really asking, maganda ba talaga yan, Casey? Effective ba talaga yan, Casey? Nag-work ba talaga yan?
Actually, some people who have watched my video already DM'd me na po, Doc. And I told them na until now, talagang nagtitake effect pa po yun.
I know.
Yeah.
Your eyes are so enchanting now. And we're still like actually doing a continuation of the Ulthera for Casey. So we will still do a furthering of the perfect V contour because we've done like few shots, so we will still be adding on the Ulthera shots. Thank you so much. Okay, Casey, God bless. Thank you for trusting us, and God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.